Top TV, Truth of the People.
Ladies and gentlemen, welcome to my wellness show where we bring you all the human interest stories. I'm Cynthia Nyaboke, and today we are going to take you through mental health awareness. And today in studio, we have a special guest. He's a student from Multimedia University of Kenya, and he is going to introduce himself.
So, my name is Suleiman Chenge. I'm a third year student at the Multimedia University of Kenya and also part of the student body at the institution. And today we are going to talk more about mental health and particularly depression.
So what is depression?
Okay, depression is whereby the things that affect someone's mental health and everything to enable to disable him or her to do their normal functioning. There are things that don't allow him or her to perform their duties effectively as a normal person would. So those are the things that are all over their minds that don't allow them to do things as they should be as a normal person. So they tend to disrupt their normal functioning of the day.
All right, and people say there are different types of depression.
Yeah.
Can you tell us one or two?
Yeah, there are different types of depression, but the major ones are bipolar depression, which tend to affect the mood of a person. Like literally you tend to see that someone is always sad and so on. That's the bipolar type of depression. Most of the time this person will be on low moods and everything. And then there's the other type of depression whereby it's called the clinical depression. It's kind of a mental disorder which most particularly is treated in hospitals because it tends to be because of a long-term problem, like for example, someone lost their parent like a year ago, but that feeling has never left them. So that type of depression, clinical depression, tends to keep on repeating itself in a person. Yeah.
How will I know someone is depressed? They tell us some of the symptoms of depression.
It's easy to know if someone is depressed. Particularly, you'll know someone is depressed if you have a close link with that particular person. One, a depressed person will lack appetite of eating anything, like he'll be just down. Particularly on the ladies, they'll tend to cry a lot. Also, someone who has depression will spend most of their time doing things that kind of don't matter to them. They lack sleep. Some of them will stay all night, but they are doing nothing. So the main signs of depression is like lack of appetite, sadness, sorrow. They don't sleep. They are just occupy themselves with unnecessary things that they don't add benefit to them.
Okay. What are the physical causes of depression? The ones we can see.
The physical causes of depression, one is these people tend to injure themselves because, take for example, a person who is depressed over, let's say, something like which is common among the young people, heartbreak and stuff. So this person, in each and everything they are doing, they'll tend to focus and pay their attention on what is disturbing them. So if this person is, let's say, cooking or driving, they'll not fully focus on the activity they are doing because their mind is occupied elsewhere. So if a person is driving and is depressed, it will be easier for him or her to cause an accident, or the same case while cooking, you can just burn yourself and end. So those are the types of physical pain they inflict on themselves because their mind is always occupied on other things rather than the actual activity which they are undertaking at that particular moment.
Talking about students.
Yeah.
There's this meme circulating that tunainama.
Yeah.
Can you say that lack of food, let's not say lack of food, a student not eating, people use memes as a way of hiding the depression part. So is it true?
Yeah, okay, not only on students. For a student to lack something to eat, it's as a result of financial constraints. And financial constraint tends to be a cause of depression in almost everybody in the world because without any funds to facilitate your operation, you'll tend to be depressed. Coming back to the student, as a student, one of the main causes of depression as a result of financial constraint at school is not everyone lacks finances. So you'll see some of your friends have the finances to even afford 4 or 5 meals a day, yet you can only afford 1 meal a day. So that tends to kind of depress them because they see themselves as lesser human beings. That is one of the things that tends to make them depressed. And the fact that Kuinamo, as it's used in memes, it doesn't cure depression because it hurts you more because knowing that this is something that is affecting you. So it might appear that it's helping, but it is making it worse because it is repeating itself. Yes, I'm facing a problem, but why should people make fun out of it? Yeah.
Yeah, earlier you talked about appetite.
Yeah.
So, how can depression affect appetite and weight?
Okay, it will affect in this manner. As I used an example earlier, let's talk about heartbreak here, right? Because as young people, that's what affects them mostly. So this, let's use this particular girl will lack appetite because of this. She was doing everything to the boyfriend before they broke and everything. So at times when you think like cooking, you want to eat something, your mind will be fully occupied on that particular guy, what is eating, who is he with, and stuff, and so you'll not like kind of find that time to think of, I need to eat. So okay, to other people they note that this particular person is not eating and stuff, losing weight and everything, but you, because your mind is already occupied, because from your mind that's when I have not eaten and let me cook something, let me eat something. But since your mind is fully occupied on other stuff, you'll not like think about eating and stuff, so you'll tend to lose appetite and everything. You'll not eat, you lose weight. Other people, it will be easier for other people to notice about that, but you'll not notice.
Let's say this girl,
yeah,
she's petite,
yeah,
and then the heartbreak comes,
yeah,
but instead of her being smaller, she becomes big. So can we say that depression can also affect your weight? So like instead of reducing, you can add a lot of weight.
Yeah, it can, because you'll find that particularly the girls, as you have said, the petite one, tend to do some exercise and everything. They tend to maintain their bodies, right? Mm-hmm. So at this particular time, they'll not be focused on maintaining their body. Like they leave everything because they say, okay, I was maintaining myself all along, but this shit happened, you see? So like they'll not focus on maintaining themselves. They'll focus on knowing what should I do, what is the other person doing. Particularly if they have the one who have been, like the guy cheated on them, they'll be so into them rather than thinking of themselves. So the morning routine that they tend to do, everything, the diet that they observe, they'll not, so they let loose of themselves. That's when, and it will not only affect their weight, increment in weight, it might affect other things, particularly on the lady side. So not particularly on weight, other things, yeah, it can affect.
And let's say someone is depressed.
Yeah.
How will I approach her or him?
One of the best way to approach someone who is depressed, do not victimize them. Just go to them, the problem that is affecting them, appear to be part of that, to be inside that problem. Like you are also a part of it. Like when you victimize them, you say, okay, yeah, yes, I have this problem, but because someone has victimized, it's true, it is a problem. But if you, as a person, you're approaching them, you tend to make it that it's not a big problem, it's something simple and easy, we can work through it. It will be easier for them, because, okay, if someone is not seeing as a major problem, where should they see it as a major problem? But the moment that you tend to make it a milestone on them, it will affect them more. But so you should become with the problem, let it be seen to them that it's not a major problem, it's something normal, and that way they'll be able to like be done with it.
Talking of effects of depression, how far can it go? Can it lead to death or something? There's nothing worse than death, but
yeah,
can it lead to death?
Particularly if depression is not focused on, like someone does not notice that you're depressed and tries to help you, the last option of depression is always death. Like, let's say, for example, a person loses their parent, right? And this particular parent, or rather a good friend, was their everything. They would tell them everything, each and every moment they are talking to them. So if you tend to lose this particular person, then no one else comes to rescue you and everything. Okay, you say, I used to live a normal life because this particular person was with me. So now if they are gone, I don't see the essence of living anymore. So depression can particularly lead to suicide, and it's one of the signs of depression. The major signs of depression is suicide. One thinks, okay, this problem is bigger than I am, and the best way to run from it is just to die. Yeah.
Is depression treatable, and how?
Yes, depression is treatable. There are two major ways of treating depression. One, which people tend to misuse, is taking antidepressant pills. Okay, yes, you might take antidepressant pills because they alter your functioning of the brain, and so as the doctors try to explain. But the best way to treat depression is to take a therapy. Like, just go to a doctor or someone that you can trust with your problem. Just talk to them. Talking at least really. Talking to people at least reduces the intensity of depression in you. So the best type of treating depression is just going for therapy, but also you can use the antidepressant, but don't overuse them.
Tell us some of the myths of depression.
Okay, some of the myths of depression is, as I have said, that antidepressant will cure depression. They don't. Okay, they help, but they don't fully cure it. So you need to take antidepressant if you have to take them, and also talk to someone. Just go for that therapy. And there is another myth about depression, that it only affects women. It doesn't. Also, men tend to be affected by depression, and for men it's worse because men rarely talk about the problems that they face. Okay, ladies are better because they can easily approach someone and talk, but when coming to men, that's why depression is never that focused much on men, because men don't talk about their problems. So there is other myth that depression only focuses on women. Another myth about depression is that it is hereditary. Okay, like you might find someone from the family where they come from, there were personal stories about their families breakup and everything. There was not that strong unit about a family. So you tend to think, also, if I have a family, the same problems will keep repeating to my family. So people tend to think that it's hereditary, but it is not. So those are some of the myths that people tend to associate them with depression.
There's this quote. It says that money can heal depression.
Yeah.
It's actually a thing that most of the youths they say it. That maybe someone was depressed, but the moment that they receive money, they are okay. So is it a myth, or it's something that it's always there?
Yeah, it's a myth, because to be honest, money does not heal depression. Okay, yes, you might have money, but if you are depressed with other factors other than money, okay, money can be one problem that may cause depression, but if your depression is as a result of anything else apart from money, it will not cure your depression. We have multi-billionaires who have everything in the world, but they are still depressed because the type of depression affecting them, for example, they don't have a stable relationship, they don't have a child, they lost someone and stuff. So money does not cure depression, not unless it's the root of your depression, of which even if you get the money, you'll tend to find other problems that might cause depression other than money. Yeah.
And at what age does depression occur?
Okay, the average age at which depression particularly tends to occur is from the age of 22 all the way to 30, but the actual after diagnosis, it tends to affect people from the age of 31 onwards. But at the current era, even the youth tend to be depressed, but because they are depressed because of things, they want things out of their control. You are 20 years old, yet you want to live like someone who has worked for 30 years old. So that cannot be fully described as depression. That probably may be another sort of problem, but it's not depression. But the average age of depression is from the age of 22 onwards, but after diagnosis, it starts from the age of 31. My take on this topic, particularly advising the youth, because as a student leader, we have come across various students who are depressed because of things that, okay, to them they might seem a milestone, but to us it's something simple. To any person who is depressed with anything, take a look back to like 2 years ago. Each and every person, like 2-3 years ago, what was that particular problem that was affecting you? How did you cope up with it? Okay, back then it might seem that it was a big problem to you that you cannot go away with, but eventually you managed to maneuver through it, and now you're okay. The same problem that is affecting you today, 3 years to come, it will not be a major problem to you. And in this world, there is no problem that no one else has ever gone through. The problem that you have, there are millions of people who have undergone through the same problem and they have made it through. So don't let depression take over you. You can just walk through it and you'll all be okay. So the last take is just be you. There's nothing that you cannot overgo, and talk to people if you feel depressed, and you'll be okay.
Thank you so much, Suleiman, for being here with us today. And to the youth out there, don't take depression lightly. If you feel like you're depressed, make sure you talk to someone and you will be okay. Until next time, ciao.